heart disease is not inevitable and continues to be the largest single cause of death worldwide. But familiarity seems to breed contempt, even if it runs in your family. There are 5 important heart disease risk factors that you can control, and that includes a poor diet, high blood pressure and cholesterol, stress, smoking, and obesity are factors shaped by our lifestyle and can be improved through behavior modifications. Good day, everyone. My name is Ylisha NOROñA from the Bachelor of Science in Nursing 3rd year Section D, along with Ms. Renzel de Leon from Section B. And today we will be discussing one of the known cardiac problems called the angina pectoris. So let's begin. What is angina pectoris? So angina pectoris is a clinical syndrome marked by episodes of chest pain or pressure, typically felt in the anterior chest, arising from reduced blood flow through the coronary arteries. This reduction in blood flow leads to an insufficient oxygen supply to the heart muscle, particularly during times of increased demand, such as physical exertion or emotional stress. In other words, angina occurs when the heart's need for oxygen exceeds the available supply. So basically, angina pectoris is the medical term for chest pain or discomfort that occurs when a part of our heart doesn't get enough blood and oxygen. It is most often just called angina. So angina can be a symptom of coronary heart disease, but it can also have other causes, which will be discussed later on. For the prevalence varies based on age, gender, and cardiovascular risk factors. Angina is more common in older adults and affects more men than women, though after menopause, the prevalence in women increases. Angina pectoris often accompanies coronary artery disease, which is prevalent in individuals with a history of hypertension, hyperlipidemia, and smoking. So, ischemic heart disease is a major cause of death and disability worldwide. While angina represents its most common symptom, angina has been shown to double the risk of major cardiovascular events. So, every year in Europe, there are at least 4.1 million deaths that occur due to the coronary artery disease, with 82% of these deaths in people older than 65 years. So the incidence and prevalence of patients with angina is anticipated to increase in the coming decade as a result of aging populations, more widespread use of life-prolonging therapies, and the better management of acute coronary syndromes, as well as the obesity pandemic. Angina also has a negative impact on quality of life and leads to a 3-fold higher risk of disability, a risk of losing their jobs that is 1.5 times higher, and 4-fold higher risk of depression. So, here in the Philippines, there is a paucity of data on the incidence and causes of chest pain. However, studies have shown that among patients admitted for acute coronary syndrome, typical angina was the predominant complaint in 79% of Filipino patients. Angina is relatively common, but some people may not be able to tell it apart from other types of chest pain, such as heartburn. If you have unexplained chest pain, it is important to get medical help right away. Now let's move to the different types of angina. So we have 5 different types of angina. That includes stable angina, unstable angina, variant or Prinzmetal angina, also known as vasospastic, silent ischemia, intractable or refractory angina. So first for the stable angina. So stable angina is a type of chest pain that happens when your heart muscle needs more oxygen than usual, but it is not getting it at that moment because of heart disease. This can happen when it is cold outside or you're exercising. And also, stable angina is a temporary chest pain, but it can eventually lead to acute coronary syndrome. Then we have the unstable angina, which happens when your heart muscle doesn't get as much oxygen-rich blood as it should. This happens because of plaque blockages and usually a blood clot in one or more of the arteries that feed your heart. Your heart muscle can't get enough blood while a blood clot is blocking your coronary artery, and this can lead to permanent heart muscle damage or heart attack due to their rupture. Then we have the variant or Prinzmetal angina, also known as vasospastic angina. So it is a rare and sometimes severe type of angina. This is actually kind of a a subclass. It's kind of a subclass of unstable angina. It usually happens before midnight and the morning while you are asleep or resting, unlike stable angina that's caused by physical exertion or emotional stress. So the difference between stable angina and variant or prince metal is that stable angina is actually caused by some stressors, physical stressors, emotional stressors, or whatever. And while variant prince metals or angina is a little more unpredictable, hence it is rare and it is sometimes severe. Then next, we will go to the intractable or refractory angina. So the intractable or refractory angina is a chronic and persistent form of angina, also caused by reduced blood flow to the heart. This is a condition in which patients of heart disease continue to suffer from recurrent restricting oxygen even though they're following the right medication plan, and it often responds poorly to treatment. Then last is the silent ischemia. So the silent ischemia occurs when the heart temporarily doesn't receive enough blood and thus oxygen, but the person with the oxygen deprivation doesn't notice any effects. So what separates silent ischemia from the other types is that you don't actually feel it at all. It goes unnoticed, unlike the other four that can be felt. For the signs and symptoms, we have shortness of breath, pallor or pale skin, diaphoresis or what we know as excessive sweating, dizziness or lightheadedness, nausea and vomiting, pain or discomfort in the chest ranging from mild indigestion to a choking or heavy sensation in the upper chest, retrosternal or deep chest pain that is often felt behind the sternum, poorly localized pain or discomfort that radiate to the neck, jaw, shoulders, and inner aspects of the upper arms, typically the left arm, and then weakness or numbness in the arms, wrists, and hands. So we will be discussing later in the pathophysiology on what exactly leads to these signs and symptoms of the angina pectoris.
So, hi everyone, I am Renzel de Leon, and today I will be discussing the part of the report which is the diagnostic exam, and this includes first is the 12-lead electrocardiogram, which it detects the ischemia or the myocardial infarction by showing characteristic changes in the ST segment T wave or the presence of the Q wave. The next, we have the coronary angiography, which it involves injecting a contrast dye into the coronary artery through a catheter to visualize and assess the severity and location of the blockage or the stenosis. Then we have the stress testing, which it evaluates the heart's response to the physical exertion or the pharmacologic agents, revealing ischemia through ECG changes, symptoms, or imaging abnormalities during the increased cardiac workload. The next, we have the cardiac biomarkers, which it is helps identify the myocardial injury or infarction by detecting the proteins released into the bloodstream from damaged heart muscle cells. Then we have the echocardiogram, where it uses ultrasound waves to create an image of the heart, allowing assessment of the cardiac structure, function, and detection of the ischemic changes, wall motion abnormalities, or other cardiac conditions. Then we have the nuclear imaging, which it involves the uses of the cardioactive tracers to evaluate the myocardial perfusion and detect areas of the reduced blood flow indicative of coronary artery disease. I will be discussing the factor age, smoking, lifestyle, and some of the alcohol consumption. So first, let's go to the factor age. So we all know that as we age, there is a decrease in lumen diameter of blood vessels, particularly in small arteries. This decrease is often associated with the development of atherosclerosis or other conditions. However, effect of aging on the blood vessels diameter can vary depending on the specific blood vessels and individual factors. So the other related changes in the blood vessels includes the reduced elasticity and endothelial dysfunction. So we all know nga kapag we grow old, so in the anatomy it says that the tissues of our body or the individuals nagkakayon sa dysfunction, nagkakayon na latsan nagdiditoy era function or dire na good era function sito bata pa sira is the same as nag-old na sira. So mayaon lat ang mga tissue is nag-reduce an era elasticity. So because of those factors naapektuhan ang mga tissue is for example adin na nga aton the blood vessels. So halimbawa nagkayon san reduced elasticity, may dysfunction, syempre magkakayon san decrease san lumen diameter kay diri na siya dilate, diri na siya ganun. So, may ito nangyari. Kaya, mayon sa decrease lumen diameter of the blood vessel. So, after that, syempre, kapag may narrow way and blood, magdi-decrease ang blood supply. Kaya, nagkayoon kit sa decrease myocardial blood supply. So, syempre, if ang agihan san blood, dida sa blood vessels is parang nag-narrow, dito'y na, piguot na, so, magkakayoon san, dito'y lang nga blood and makakaagi. Syempre, mauman ang iyakuan. Kaya nagkakayoon sa decreased myocardial blood supplies. Dito'y naan supply sa cardiac muscle. So, and if there is a decreased blood supply, the body will try to compensate and magdidemand siya sa oxygen para sa body. And if there is still low oxygen, especially sa heart, magkakayoon na sa myocardial ischemia, which is the myocardial ischemia nag-occur siya when the blood flow to your heart muscle is reduced, preventing it from receiving enough oxygen. Kaya mo siya nagkayoon sa myocardial ischemia. So the next we will be discussing the factor smoking cigarette or cigarette. So I will continue the pathophage of the age later sa lifestyle and diet kasi same lang yung dinadaanan nila. So now we will be discussing the smoking or the cigarette. So, smoking and cigarette. So, kapag nag-smoke ka, may mga chemicals ito siya na upod. Like, may mga toxic chemicals and cigarette na it could damage the endothelial cells and reduce the ability to produce NO or also known as the nitric oxide. So, the nitric oxide is a potent vasodilator. So, ito na vasodilator, it relaxes the blood vessels and it improves the blood flow. So, ini-mention is na pag nag-cigarette ka, di ba nga may chemical siya na ginagawas, kukuan niya, reduce niya ang ability sa naton lawas na mag-produce an NO. Which is, NO is very important kay vasodilator gani siya. So, kapag sigilan smoke, and umabot na sa waray production sa nitrate oxide, like dito na ang production of nitrate oxide, maglilid siya to increase oxidative stress na, which is the oxidative stress damage the endothelial cells, leading to the inflammation and increase permeability. Kaya mayon kit sugad na increase of vascular permeability. Since na may damage na ang endothelial and magkakamay-ada na sa inflammatory response, which the inflammatory response, there is a release ng chemical mediators such as the histamine and other chemical mediators or etc. that increases the vascular permeability. Kaya mayon kitsan permeability sa may increased permeability sa smoking and cigarette. And then, remember na ang permeability is gininaalaw niya ang mga substance na makasulod. Kasi di ba permeable na, pwede na siya makaagi ang mga substance. So, since there is an increase of vascular permeability, it allows the lipoprotein like the LDL to penetrate the endothelial layer and accumulate in the subendothelial space. Kaya there is an increase of the LDL or the cholesterol. Kaya nagkasulod na sira sa blood vessels. Nag-accumulate na sa rangada, kay naging permeable man an aton blood vessels. So, I will continue discussing that the increased LDL to accumulate in the lifestyle and diet factor. So, then next we have the lifestyle and diet factor. So, in the lifestyle diet factors, so there is a increased LDL and cholesterol. Since halimbawa sa imo diet, like you tend to eat fatty foods, like mahilig ka sa mga fatty foods, there will be an increase of LDL or cholesterol. So the factors lifestyle and diet can also cause angina, like in your dietary intake, just like what I've said, like consuming a diet high in saturated fats, like found in the red meat, ito mga dairy products na full fat, mga may oil, ganon. And the trans fat also, nga naagihan siya sa mga processed food and then fried food. It will increases the cholesterol or the LDL in the bloodstream. So, if a person naman like has still poor diet, like gihap, like diri siya healthy, iya gini-eat, it causes damage to the endothelial cells lining of the of the arterial wall. So, kapag sigmula kaon sa mga diri healthy nga food, mga junk food, ganon, nakaka-apekto siya sa lining sa endothelial cells. So, which this damage leads to the endothelial dysfunction, which endothelial dysfunction increases the permeability of the arterial wall, allowing more LDL particles to penetrate in the inner layer of the artery and causes accumulation of the LDL cholesterol on the arterial wall. So, LDL particles now bind to the proteoglycans in the extracellular matrix of the intima, or also known as the inner layer of the arteries. So, this retention is crucial to keep LDL in the arterial wall, where it is more susceptible to oxidative process. So now the factors in the lifestyle and diet, such as the smoking, like halimbawa sa imo life, diba, sa factors and lifestyle and diet, sa imo lifestyle, so nag-smoking ka, mayroon ka sa permi and high blood glucose level, it will damage also the endothelial cell, which it increases the production of the reactive oxygen species, or the ROS, which this ROS can oxidize the LDL particles in the arterial wall. Kaya nagkakayon kitsan LDL undergo oxidation. So now that adinakat sa LDL undergo oxidation, we will now go sa inflammatory response. So now, since that the LDL are na-oxidize na mga lipids, the oxidized LDL, gina-activate niyan immune cells, leading to release inflammatory substance and causes inflammatory response. So, an LDL, gina-activate niyan immune cells na nagli-lead sa inflammatory substance, kaya nagkakayon kitsan inflammatory response. Remember na an inflammatory response, there are molecules, di ba? May mga molecules sila nga nag-release and attracts the monocytes, which is a type of white blood cells. Kaya nagkakayon kitsan monocytes nga niyan after sa inflammatory response. So, once in the arterial wall, the monocytes differentiate into macrophages, and macrophages are specialized cells that gini-engulf niya and digest the foreign substance. And the macrophages begins to engulf the oxidized LDL or the OXLDL, cholesterol or lipids particles. So, and the cholesterol accumulates within the macrophages, nag-transform na sila into foam cells. The accumulation of the foam cells within the intima or the inner layer of the artery leads to the formation of the fatty streaks, which are the earliest visible lesions of the atherosclerosis. Foam cells secretes a pro-inflammatory cytokines, the chemokines, and growth factors that perpetuate the local inflammatory response. So, this inflammation nag-attract siya sa more monocyte to the site and promotes recruitment and proliferation of the smooth muscle cells. So for short, magdadamo ang LDL, mag-inflammatory response, mag-ingest na natin monocyte, tapos magdadamo na liwat ang LDL, mag-inflammatory response, paulit-ulit nito siya. So over time, the ongoing inflammation and the lipid accumulation leads to the development of the more complex atherosclerotic plaque. Kaya na mayaon na kitsan, nagkayaon na sa foam cell accumulation and plaque formation. So the ingestion of the oxidized LDL by monocytes, the subsequent formation of the foam cells and the plaque are critical steps in development of the atherosclerosis. And since may paulit-ulit na sugad siton, nagkayaon na sa atherosclerosis, which is a chronic disease characterized by the build-up of plaque within the walls of arteries. This plaque is composed of the cholesterol, fatty substances, cellular waste products, calcium, and fibrin. And as it accumulates, it narrows the arteries, reducing the blood flow to the organs. So, ginpapadito niya nagihan sa mga bloods pakadto sa irang mga specific nakakadtuan like sa mga other organs, vital organs. So, as the plaque grows, it can become unstable and rupture. So, kapag ang plaque ko no like mag-grow, sigilan kuan sa mga fatty substance in the blood vessels, mag-grow siya which can rupture. So this exposes the underlying tissues rich in cholesterols and other substances to the blood flow. So since may build up in the inner layer of the arteries, mayaon itong sira cup, like an build up nga na may cup siya, parang an ganon didi. So, itong siya, ang didi niya is very prone to rupture. Kay manipis itong siya. May manipis, may dakmol. Pero sa sobrang nga, kadamo na san sulod, pwede siya, very prone siya san rupture. Kapag sigilan build up san mga fats, mag-rupture ini siya, kaya mayon gatin sa sugad na plaque rupture. So, when the plaque rupture naman, it triggers a cascade of events that leads to blood clot formation. So, syempre, sa sulod sa blood vessels na mismo, kapag may nag-rupture nga to, anihin mo talaga sa platelets is makanto sira nga to, maghihimo sira sa blood clot, ganon. So, the platelets, which is a blood cells involved in clotting, will adhere to the rupture plaque and releases substance that promote further clotting. So, nag-blood clot na nga to, results to the formation of blood clot or the thrombus. Kaya may katusugad na thrombus. Then, the thrombus can partially or completely block the blood vessels, reducing or stopping the blood flow to the affected organ, which can cause various problems such as decreased myocardial blood supply. So, since nagkayon sa blood clot inside the blood vessels, it could block the agihan sa blood. Like, di rin siya makakaagyan mga blood or dito yan agihan sa blood. Kaya magkakayon sa decreased myocardial blood supply. So, magbalikit nga sa atherosclerosis. Kaya di ba atherosclerosis can cause pwede magkayon sa plaque rupture, pwede lahat magdiretso sa decreased blood vessel lumen diameter. Since the fats, di ba, and kapag there is a buildup of plaque within the wall arteries, it decreases the blood vessels lumen diameter. Kaya mayon sa mga fats and plaque, di ba? Like, nakaulang sira nga da. Kaya nagkakayon sa narrow passageway of the blood. Kaya nagkayon sa decreased myocardial blood supply or blood supply to the heart muscle. So, and if there is a decrease in blood supply, the body will try to compensate and demand na magkayon sa oxygen para sa body. So, and if there is still low oxygen, especially in the heart, magkakayaw na sa myocardial ischemia. So, which this myocardial ischemia nag-occur when the blood flow in your heart or to your heart muscle is reduced, preventing it from receiving enough oxygen. So, di ba? An occlusion dito, partial occlusion sa blood vessels, tapos ang decreased lumen diameter both result decreased myocardial blood supply, and then because of there is a decreased myocardial blood supply, nagkakayon sa myocardial ischemia. So, the reduced blood flow to the heart muscle due to the occlusion and the decrease of blood vessels diameter leads to the oxygen deprivation. In response to the oxygen deficiency, heart muscle switch to anaerobic metabolism. So, ito siya, heart muscle, nag-switch siya sa oxygen absent. Kay kulang naman oxygen, so mag-anaerobic na siya metabolism. Which this anaerobic metabolism produces or producing lactic acid as byproduct and metabolites that stimulate cardiac spinal afferent nerve, which is a cardiac spinal afferent nerve or sensory nerve fiber sira nga nag-transmit sira sa information tikang sa heart pakadto sa spinal cord. So ini sira nga mga nerves plays crucial role in regulating heart function and in the perception of cardiac pain. So, since this substance liwat nag-irritate sa rest and cardiac nerve. So, the irritated cardiac nerve na is stimulated. So, na-stimulated siya and send signal to the spinal cord. So, the myocardial visceral afferent and the somatic sensory nerve fibers ang nag-i-enter sa spinal cord specifically. Kaya di ba, ini nga irritated cardiac nerve nag-stimulate, tapos nag-send signal pa sa spinal cord, maagi sila, mag-enter sila sa spinal cord. Kaya mayon kay sugad na entrance to spinal cord via T1 and T4 nerve root. So, next we have now the in the spinal cord, ang cardiac nerve fiber magmi-mixed with the somatic sensory nerve fiber, which there is a phenomenon which this phenomenon is known as the convergence. So the convergence may siya kay nagkakain sa mixed up of some nerve fibers, di ba? Nag-share sila kasi sa agihan pakadto sa spinal cord. Kaya nagkakain sa mix up ganon. So dahil ito na mix na signals, the brain interprets the increased nerve signal from the mixed fiber as pain originating from the skin area supplied by the same spinal nerve, the T4 and T4 dermatomes. This is called the referred pain. So, imbes na sa heart adto, dahil nagkayo sa mix, ngadto sa pag-abot sa spinal cord, nagkayo sa mix, so ang gases sa naton brain nga din siya sa parts ito na skin. So, the misinterpretation leads to the pain radiation to the left arm, jaw, abdomen, and upper back, and chest pain, pressure, or discomfort. Kaya nagkayaon san pain nga di sa nag-radiate baka di sa left, sa jaw, sa abdomen, dahil because of the referred pain, dahil sa mixed nga nangyari nga signal nga to sa aton spinal cord. Nagkayaon sa chest pain, pressure, or discomfort. Kaya ganon siya. So, if the chest pain often occurs suddenly or is more severe and lasts longer than typical angina, this can lead to unstable angina. So, kapag ito na chest pain, sigila pabalik-balik ganon, nagli-lead na siya sa unstable angina. Let's go back to anaerobic metabolism. Diba sa katapusan myocardial ischemia, nagkayoon sa anaerobic metabolism. An anaerobic metabolism, mayon siya duwa nga di, the stimulation of the spinal afferent nerve and then to increase lactic production. Since na-explain ko na sa stimulation of the spinal afferent nerve, then next we will be explaining this part, the process where there is an increased lactic acid production and the decrease of cellular pH. So, the reduced blood flow to the heart muscle due to the occlusion and the decreased blood vessels diameter leads to oxygen deprivation. So, in response to oxygen deficiency, the heart muscle switch to anaerobic, which is the oxygen absent metabolism, producing lactic acid as a byproduct and causes increased lactic acid production and decreased cellular pH. So, the accumulation of the lactic acid can impair the cardiomyocytes function and the heart muscle's ability to contract efficiently. So, ito nga mga lactic acid gin-i-impair niya, gin-damage niya, or nawakan niya ang mga in-impair niya ang cardiomyocytes ang mga cells nga sa heart, ang mga heart muscles, tapos ang ability sa muscle na mag-contract efficiently, which is contraction is very important sa heart. So this damage, cardiomyocyte impairs myocardial relaxation and causes decreased left ventricular contractility and cardiac output. So a decrease in left ventricular contractility leads to the reduction of the amount of blood pumped out of the heart with each beat or the cardiac output. As the heart's pumping action weakens, blood begins to back up in the left ventricle, which this increases the pressure in the left ventricle known as left ventricular failure. So dahil mayon nakatsan nag-decrease ang ventricular contractility, ang pagpump niya is mahinay na, so ang blood diri nakakadiretso pa kadto sa aton body tanan, nagbabalik siya. Pagbalik niya nagdadamo ang nagba-back up ang mga blood nga sa left ventricle, sa ventricle, so sa left ventricle. So dahil siton nag-i-increase ang pressure nga sa ventricle kay adala nga tanan ng mga blood. So the increased pressure in the left ventricle is transmitted backward to the lungs, increasing the pressure in the pulmonary arteries, kaya may increased pulmonary pressure. So syempre imda kapag ang mga blood adi nga di sa left ventricle na accumulate, pag pump niya dahil sa sobrang kadamo sa blood nga nag-stuck or nag-accumulate, pag pump niya, pag igbaw niya nga di sa pakadi sa aorta pakadto, diri siya na dito ila nakadto kay mahinay naman iya contractility. So ang iba nabalik nga di sa lungs. So nabalik nga di sa lungs. So dahil sa pagbalik sa lung, nagkakayon sa increased pulmonary pressure. So the increased pulmonary pressure makes it harder for the lungs to exchange oxygen and carbon dioxide. So as a result, the blood becomes less oxygenated, further impairing the heart's function, causes tachypnea and dyspnea. Kaya mayon sa shortness of breath or tachypnea or dyspnea. So mao ang mga sign and symptoms sining the angina, one of the sign and symptoms of the angina pectoris. So the next factor is the alcohol consumption. So the alcohol consumption is same mayon siya same flow as para sa lifestyle and diet. So kapag alcohol consumption, sige mo na inom, ganon, it will increases the LDL, the cholesterol, it will, the LDL or the lipids will accumulate in the arterial wall, and then it will undergo oxidations, and then because of the oxidation, it stimulates it stimulates the inflammatory response, which in the inflammatory response it releases chemicals or mga mediators that it will attracts the monocyte. Well, the monocyte na will ingest the lipids or the oxidized LDL, tapos magkakayaon sa foam accumulation, and so on and so on. Same na sira sa flow. The age, the smoking, the alcohol consumption, lifestyle and diet, may sira same na ginaagihan bago magkayaon sa angina pectoris or unstable angina pectoris. So the other two factors will be discussed by my other partner.
Another factor is the alcohol consumption and diabetes. So this leads to hyperglycemia. So persistent hyperglycemia leads to glycation of proteins, including those in the walls of blood vessels. When we say glycation of proteins, this refers to the bonding of a sugar molecule or lipid molecule without enzymatic regulation. So what do you mean by enzymatic regulation? So enzymatic regulation refers to the multiple mechanisms available to control the activity of enzymes. So in hyperglycemia, we have this process known as advanced glycation end products, in short called AGES or AGES, as in capital AGE, which results in structural changes to the blood vessels, increasing stiffness and narrowing. So these changes impair the ability of blood vessels to dilate, thus reducing coronary flow reserve and increasing the risk of ischemia. So after hyperglycemia, it will lead to dyslipidemia. Dyslipidemia refers to the abnormal lipid profile, or when the amount of lipid or lipoproteins in your blood is abnormally high or low. So dyslipidemia promotes the formation of atherosclerotic plaques in coronary arteries, which narrows the vessels and increases the risk of myocardial ischemia, therefore exacerbating angina. So the treatment for this involves glycoprotein 2B or 2A receptor blockers. So glycoprotein 2B or 2A receptor blockers such as tirofiban, lamifiban, epifibatide, or abciximab inhibit platelet aggregation by preventing the binding of fibrinogen and the von Willebrand factor and other adhesive molecules to glycoprotein 2B or 2A receptors on the surface of activated platelets. So if untreated, this will lead to an increase in platelet aggregation. Platelet aggregation is a major factor in the development of thrombus or blood clot formation. So how does this relate, or how does this connect? How does this relate to alcohol consumption and diabetes? So first, for diabetes, diba, nagkakaroon ng hyperglycemia. So pag may hyperglycemia, nag-increase yung production ng protothrombic factors kagaya ng fibrinogen and activates the platelets, impairs the function of endothelial cells, which normally help regulate platelet activity and prevent clot formation. Then, sa alcohol consumption naman, yung nangyayari dito, pinopromote niya yung platelet activation and aggregation, altering the balance between prothrombotic and antithrombotic factors, leading to a hypercoagulable state or hypercoagulation. So hypercoagulation, this refers to a blood disorder in which the blood forms clots easily or quickly. So dito maganda kasi pwede itong mag-lead to blockage, and then eventually magkakaroon ng rupture dahil sa pag-form ng plaques. So together, this platelet aggregation and the formation of thrombi within the coronary arteries can obstruct the blood flow, yung nga minention ko na kanina, precipitating episodes of angina and even leading to myocardial infarction or heart attack. Then, after ng pag-increase ng platelet aggregation, syempre, mag-weaken rin yung function ng red blood cells natin. So, there's the decrease of RBC function. So, this could lead to kidney damage if untreated. So, to treat this, we need thrombolytic therapy, percutaneous transluminal coronary angioplasty. So, thrombolytic therapy can include the use of medications to destroy blood clots or prevent new blood clots from forming. Then, ang percutaneous transluminal coronary angioplasty naman, or PTCA, is a minimally invasive procedure that opens blocked coronary arteries to improve blood flow to the heart muscle. Then, if untreated, this will lead to thrombus formation. So, pag may thrombus formation, this could lead to plaque rupture and formation of blood clots. So, anong nangyayari sa plaque rupture? So, sa plaque rupture, atherosclerotic plaques in coronary arteries may rupture due to mechanical stress or inflammation. So, when this happens, the underlying material such as collagen is exposed to the bloodstream, triggering the coagulation cascade. Sa blood clot formation naman, pinopromote niya yung formation of thrombi which can obstruct the coronary blood flow. So this leads to myocardial ischemia and results in unstable angina or even myocardial infarction or heart attack. So ano nga ba yung cumulative impact nito sa angina pectoris? So ang combination of endothelial dysfunction, dyslipidemia, platelet aggregation, and thrombus formation leads to impairment of oxygen supply. Narrowed coronary arteries and endothelial dysfunction reduce the ability of blood vessels to dilate and provide sufficient blood flow to the heart during periods of increased oxygen demand, for example, exercise and stress. Then, increased oxygen demand, so nag-increase siya dahil sa higher heart rate, blood pressure, and contractility. Then, there's also an increase in thrombosis risk. So, dahil nga sa pag-increase ng platelet aggregation, this could potentially lead to the complete obstruction of blood flow and exacerbation of angina. Before we move on, let's first tackle another factor, which is physical exertion. So, physical exertion naman, during physical exertion, the body's metabolic demands increase, necessitating more oxygen for various tissues, especially the myocardium. So, sa physical exertion, nag-increase yung heart rate natin, meaning, nag-increase din yung heart contractility. So, pump pa ng blood. Dahil sa pag-pump ng blood pa. Then, okay, so as heart rate rises, the number of cardiac cycles per minute increases, requiring the heart rate to contract more frequently due to the sympathetic nervous system stimulation of beta-adrenergic receptors on the myocardium, leading to a greater need of oxygen as more energy is required to fuel the increased force of contraction. Then after this, there is a decreased time for coronary arteries to fill heart with blood diastole, and of course, there's an increased oxygen demand of heart muscle, as I mentioned earlier. So, for the decreased diastole, diastole refers to the phase of the cardiac cycle when the heart muscle relaxes and fills with blood. So, during physical exertion, nagde-decrease yung diastolic time natin. So, the heart rate increases, which reduces the duration of diastole. So, this reduction of diastolic time could lead to consequences. And, basically, when you say consequences, yan na yung pagkakaroon ng imbalance ng blood supply and oxygen demand, and magkakaroon ng myocardial ischemia, then leading to angina pectoris, or the stable type of angina pectoris. Okay, so balik tayo ulit dun sa alcohol consumption and diabetes. So, di ba, thrombus formation. And thrombus formation dahil sa blood clots, formation of blood clots, sa bilis ng pag-form ng blood clots. Nagde-decrease yung blood vessel lumen diameter. And then, there's atherosclerosis, decreased blood vessel lumen diameter, and then there's a decrease in myocardial blood supply. And of course, just like physical exertion, andyan yung imbalance ng blood supply and oxygen demand, causing myocardial ischemia. In addition to what Ms. De Leon has mentioned, there is also the partial thickening or the non-transmural heart wall ischemia. So, how does this happen? Diba after the myocardial ischemia, the blood flow then begins at the epicardium or the outer heart layer and ends at the endocardium or the inner heart layer. Okay, so after nyan, dun sa subendocardium or the innermost heart layer, nare-receive niya yung pinaka-least amount ng blood. So, it receives the least blood flow, causing non-transmural heart wall ischemia or the partial thickening. After that, there is an increase in sympathetic nervous system activity. So, why does this happen? So, the anterior septal and lateral wall ischemia triggers the increase of SNS activity, as this is detected by the baroreceptors. So these baroreceptors, they detect the sudden drop or the fall of the cardiac output given the proximity of the body's stress response to impaired oxygen delivery to the heart, a compensatory mechanism aimed at preserving blood flow to vital organs, especially the heart and the brain. Then after that, the adrenal medulla releases the norepinephrine hormone, leading to the binding of arterial smooth muscle alpha-1 receptors and the activation of sweat glands. So for the diba nag-release si adrenal medulla ng norepinephrine hormone. So yan, nangyayari dyan na bind yung arterial smooth muscle alpha receptors, leading to an increase of vascular tone of coronary arteries or vasoconstriction. And dyan na nagkakaroon ng hypertension. Then, another is the activation of beta-1 receptors in the heart that leads to tachycardia. So, balik na naman tayo dito sa partial thickening or the non-transmural heart wall ischemia. So, other than the increase of SNS activity, nagkakaroon din ng pag-increase ng involuntary vagus nerve activity. So, why does this happen? So, this happens because the inferior wall ischemia triggers the involuntary increase in vagus nerve activity given the nerve's proximity. And dahil dyan, nagkakaroon ng bradycardia, hypertension, and nausea. And of course, andyan na yung angina pectoris, stable angina pectoris.
So now I will be discussing the medication for the patients with angina pectoris. First, we have the nitrates. So the nitrates such as the nitroglycerin, it relieves the angina by dilating the coronary arteries and the veins, reducing the myocardial oxygen demand and improving the blood flow to the heart muscle. Then we have the beta-adrenergic blocking agent, which decreases the heart rate and contractility, reducing the myocardial oxygen consumption and helping to prevent angina episodes. Then we have the calcium ion antagonist, which it relaxes and dilates the blood vessels, improves blood flow, and decreases the heart's workload, thereby elevating the angina. Then we have the antiplatelet medications. It inhibits the platelet aggregation. It reduces the risk of thrombus formation and subsequent coronary artery occlusion. Then we have the anticoagulant, which it prevents the blood clot formation by inhibiting the various factors in the coagulation cascade, thereby reducing the risk of myocardial infarction in the patients with angina. And now I will be discussing naman the surgical management. So we have here too the percutaneous coronary intervention or the PCI, and then we have the coronary artery bypass grafting or the CABG. So first is the percutaneous coronary intervention or the PCI. So this surgical intervention is a non-surgical procedure used to treat narrow coronary artery of the heart found in the coronary artery disease. During the PCI, a cardiologist will insert a catheter through the skin into the blood vessels, typically in the groin or the wrist, and guides it to the affected coronary artery. A small balloon at the tip of the catheter is then inflated to widen the artery and improve the blood flow. So, often a stent, which is a small mesh tube, is placed in the artery to keep it open. The PCI is commonly performed in the cardiac catheterization laboratory and is less invasive than traditional surgery, offering a quicker recovery times and shorter hospital stays. It is typically used to relieve symptoms of angina, improve blood flow of the heart, and reduce the risk of the heart attack. So, next we have the coronary artery bypass grafting or the CABG. It is a type of heart surgery that aims to improve blood flow to the heart. It involves taking a healthy blood vessels from the other part of the body such as the leg, arm, or the chest, and use it to create a new pathway around the blocked or narrow coronary artery. This bypass allows blood to flow freely to the heart muscle. CABG is typically performed on patients with severe coronary artery disease who have multiple blocked arteries or when less invasive procedure like the PCI are not suitable. So the surgery can significantly improve symptoms of chest pain or the angina and reduce the risk of heart attacks. So recovery from the CABG can take several weeks, and the patient often need cardiac rehabilitation to regain strength and improve health, heart health. Ganon. Then next, I will be discussing the nursing management. So the nursing management for the patient with angina pectoris includes: first is monitoring the vital signs and the ECG. Second is assess for the adverse symptoms. Third is administer medications as prescribed. Then encourage rest during the pain episodes. Then educate on lifestyle and modification. And then instruct on medication use and support anxiety management. And lastly, we have the prognosis. The prognosis for the angina pectoris varies based on the severity of the coronary disease, the presence of the comorbidities, and how well the condition is managed. The patients who adhere to lifestyle modifications, medication, and risk factors management generally experience a better prognosis with reduced angina episodes and risk of progression to myocardial infarction. However, those with unstable angina or severe unrevealed ischemia may have poorer prognosis with a higher likelihood of complications like acute coronary syndrome or heart failure. Effective treatment, regular monitoring, and prompt management of worsening symptoms are crucial to improve outcomes. So that's all for our report, the angina pectoris. Thank you for listening.